Hi, welcome to the program. My name is Robert Groysman. I am a pain management physician and anesthesiologist, and we already have our first question from Shayna. She is asking if if the SGB um, is indicated if it's regressing, if the symptoms are regressing back. Does it make sense to repeat the stellate ganglion block right away, or to just wait and see? So the best way to answer that question is, how do you really know if the stellate ganglion block is wearing off? So the easiest way to know is your symptoms will be coming back, and to do a wait and see approach um, is kind of the way to go. There's no real advantage to going ahead and repeating the stellate ganglion block as soon as you notice the symptoms coming back. If you have been following my vagus nerve stimulation protocol, that should be happening less and less. I hope that answers your question, Shayna. One of the things I wanted to talk about in general is I have this echo. I'm trying to figure out why. Stress levels. So, how does stress affect? Sorry. How does stress affect? I can't stand this echo that I'm having. Oh, okay, good. Good to know, Kayla. So how does stress affect after the stellate ganglion block? So if you're exposed to stress, it's going to cause your sympathetic nervous system to work harder, and therefore it's promoting its activity when we want that. So under vagus stimulation or under vagus tone or parasympathetic tone, that is when you're going to heal. Um, Holly is asking, how long should we continue the vagus nerve stimulation after a stellate ganglion block? So, what I recommend is to start doing the vagus nerve stimulation before the stellate ganglion block, and then immediately after having the block, go ahead and continue to do it. You want to continue for at least 30 days, but the longer the better. In general, if the symptoms haven't regressed by 90 days, I think you're pretty much in the clear. I hope that helps, Holly. Nicole is asking about diminishing returns for using the TENS unit. So we're talking about vagus nerve stimulation here. Um, the easiest way to think about it is your vagus nerve can only be stimulated for so long, pretty much like any nerve in the body. After a certain point in time, it will just basically stop responding to any new stimulation. No matter what you do to it, no matter how hard you stimulate it or how often, it basically stops working. So we don't want to get to that point because if we do, then you have to wait until it comes back or basically starts being responsive again. We call that kind of a refractory period. So doing it twice a day is the maximum amount I recommend. And if you're gonna do it twice a day, do it several hours apart. No more than 30 minutes. I mean, you can technically go up to 45 minutes. There's some studies that show you can go to an hour. and still be fine. But I don't want to push your luck, because once you do make it refractory, you pretty much have to wait until it comes back before anything you do to it will matter. Um, I hope that helps. So, I hear a lot of people commenting that if you go on vacation, the symptoms tend to basically regress. Anything from parosmia to um, dysgeusia, anosmia, and the other symptoms associated with long COVID. And some people think it's being in an airplane or being at a high altitude, but really what it is you're getting outside of your normal routine. You're on vacation or you're traveling somewhere else where you can relax, and that brings your stress level down, and that allows the parasympathetic to do its work. Now, if you're still stuck, if your sympathetic nervous system is still stuck, then doing that is not going to help as much than if you're already unstuck. How do you know if it's stuck or not? Well, if you have parosmia or anosmia, you'll notice shifting of the symptoms. Taste and smell will come back to normal for a couple hours or a day or two, and then go back to being bad again. So that's a good way to know if you're still stuck or not. Until we get our next question, um, let's talk about sleep. The short of it is sleep is very different from being unconscious. I hope that makes sense because if somebody does anesthesia, for instance, that's not sleep. And what we're after, though, is the deep sleep aspect of it. Um, when your sympathetic nervous system is working very hard, even at night, you never really spend a lot of time in deep sleep, and you don't spend you don't never get into deep sleep. And this is where your parasympathetic nervous system does everything it needs to do. This is when your body heals. This is when cells are renewed. This is when you make new cells. And essentially, most of the healing process and repair happen at night during this deep sleep cycle. If you're not getting there, then um, you're really not able to heal. And this is the biggest rub with long COVID. So Holly's asking about peptide therapy, and that's actually a pretty much a talk in itself, or a whole series of talks. But in general, peptides are not like medications. Peptides are short protein sequences of amino acids. So it's basically when you eat anything that has protein in it, your body breaks it up into amino acids and then forms uh, basically peptides from that. So small sections of amino acids is what peptides are. They do various things, and this is pretty much what does everything in your body from a protein standpoint or messenger standpoint. There's a lot of different peptides. There's over 7,000 at this point, and new ones are being discovered every week. And some are repetitive, some do the same things together, some have different side effect profiles. And you have to kind of know what to pick and choose to get the best possible um, results. Let's see here. Verdant is asking about smell and taste disorders seem to be like PTSD. Is it that it's caused by the ANS disorder? And if it's common non-COVID to see parosmia and anosmia. Actually, parosmia and anosmia have been relatively rare, which is why a lot of ENT doctors are confused about it. We have seen them after certain mental conditions, such as Parkinson's and Alzheimer's, where they're associated with parosmia and anosmia. However, What's unique to long COVID is that initial damage to the epithelium of the olfactory bulb that happens by the virus itself, and that sets the whole process in motion. Um, then you have the cytokine storm that basically prevents the autonomic nervous system to settle down, and there's a change in the blood flow to the face and the brain and basically your nose and tongue. So that is why it's more associated with long COVID, than with any other form of dysautonomia. There's obviously, POTS and n diabetic neuropathy and other forms of, uh, dysautonomia that happen, but they don't typically associate with parosmia or anosmia or any change in taste, like, dysgeusia eusia, dysgeusia is what I meant to say. Next question is again from Shayna, um, talking about, taking peptides and how long does it take to receive full effect. Well, the effects are relatively quick. You can see them, the next day, typically. They're basically doing what your body normally should be doing, but we're helping your body stimulate something, in or decrease something, to make an effect. Amy is asking what to do if the SGB doesn't work for the first time. So, she's talking about the stellate ganglion block. So, when we're saying it doesn't work, so we're assuming that the stellate ganglion block actually worked. And what I mean by worked is you have a Horner syndrome, which is a droopy upper lid, the red of the white of the eye, a smaller pupil called meiosis, and some flushing of the face, nose, or eye, uh, and stuffiness of the nose, typically on the side that it's done. So if it doesn't work, does that mean that you don't have dysautonomia as the source of your problem? Well, no. Some people is just so trenched in there that you need to basically repeat it or make it stronger or make the effect last longer for it to get unstuck. So that upper limit for the sympathetic nervous system, uh, during the cytokine storm, it goes beyond the limit and it's stuck there. And the only way to get it to be unstuck is to do a stellate ganglion block or to do vagus nerve stimulation for a prolonged time, hopefully being able to um, get that sympathetic nervous system unstuck from the upper level where it's stuck at. Okay. Britta is asking, what happens? What's my opinion if after if people get better after 2 years, and some getting better only after a stellate ganglion block? The only surveys I found didn't really look what happens after the 2 years. The problem is we don't know if it's just compensation of your nervous system, but not really fixing the problem. It's kind of like using a crutch or a walker when you have a problem with your leg or hip. You can still walk, but it's compensated. Well, the same thing can happen with the autonomic nervous system. Your body may make certain adjustments and changes to make it seem like things have healed up, but the next time you're stressed out or the next time you have another cold or another infection with COVID, everything comes back full force. So, I'm not sure if people actually heal, until the parasympathetic has a chance to do what it needs to do, which is be active the most of the part of the day so that everything can heal. Okay, Kayla, you're very welcome. Um, with parosmia, what I'm after actually is just not having, I guess, the nasty part of the taste. It may not taste, when we do a stellate ganglion block with parosmia, sometimes the taste doesn't come back to normal, what you remember, what you're used to, but it's no longer nasty. As long as it's not nasty still, I would continue doing the vagus nerve stimulation. I hope that helps. Holly is asking if after an SGB, there's minor change to the fatigue. Will vagus nerve stimulation for 90 or more days help? I mean, it should. The idea of doing the stellate ganglion block is to try to unstick that accelerator pedal. If we've succeeded, then doing the vagus nerve stimulation kind of works from the other end. So if you think about the sympathetic nervous system sitting on one end of a seesaw or a rope, and on the other end is the parasympathetic nervous system or the vagus nerve. So when the sympathetic is high by a reflex, the parasympathetic and the vagus have to be low, and vice versa. When vagus and parasympathetic is high, the sympathetic is low. So by targeting it both ways, so with the stellate ganglion block plus the vagus nerve stimulation, you create a balance. It's hard to know if 90 days or 30 days or 60 days is what your body needs. Everybody's a little different. So Shayna again is asking if there's a good result from the stellate ganglion block, but you want more of the symptoms to go away. Can you do another stellate ganglion block? Well, yes, you can. We just don't know if those additional symptoms will respond or not. Okay, Alicia is asking, can the sympathetic nerve heal on its own, or do we need the stellate ganglion block? Well, it's not an actual nerve. It's a collection of fibers, part of the autonomic nervous system. So it's not just one single nerve. Yes, it can heal on its own. The problem is the situation long COVID sets up is that with the parasympathetic and the vagus nerve tone being low, the problem is that that inhibits healing because most healing occurs when the parasympathetic nervous system is high or the tone is high. And the majority of this healing and repair process happens at night when you're in deep sleep or stage 3 sleep. So yes, it can technically heal on its own, but it would take an awfully long time without some of the healing help that the parasympathetic nervous system provides. Verdant asks if we can continue TENS past 90 days. Sure, there's no harm in continuing vagus nerve stimulation indefinitely. The goal here is again to get the parasympathetic nervous system and the vagus nerve, the tone of it high at least for 30 minutes a day. I mean, why not do it 24/7? Well, again, after about an hour or so, it will shut down. I use 30 minutes just for safety reasons because I don't want it to shut down because everything else you do after that won't matter. So it's still even a long process with just vagus nerve stimulation, but it would be even longer if we didn't have that. So just to answer your question, there's no harm in continuing it past 90 days. I just picked an arbitrary number of how long I thought it would take to heal. I wanted to make sure I didn't miss anybody's question. Oh, yes. Hope is asking about MCAS. So we know that the mast, I'm blanking on the name now. Um, the mast cells, yes. The, the mast cell activation syndrome is associated, or the symptoms of it are associated with long COVID. I believe that this mechanism is related to the autonomic regulation of the immune system. It The parasympathetic really helps to kind of calm down your immune system and general chronic inflammation. So if that's out of balance, your immune system sometimes starts acting up, and you can get autonomic. I'm sorry, autoimmune is what I mean to say. Autoimmune type conditions like celiac disease and thyroiditis, and even rheumatoid arthritis, when the system is out of balance. Hope is asking about DNRS. I'm not quite sure what you're referring to. If you could maybe elaborate on what that is, I will try to comment on it. Shayna is asking about tracking HRV, um, and how many days I consider would be considered trend. So at least a week to 2 weeks, I would consider a trend. So what we're looking for is the average number that um, that would be on each day, and we want to spend some of the time, at least part of the day, in higher numbers of the HRV. If it's always low, then yes, that's going to be a problem, and that signals that your parasympathetic is pretty much not working. Hope said dynamic neural retraining for DNRS. I'm not really familiar with this. I'm sorry, Hope. I will look into it though. And if you're in my group, then we can discuss it there. So when people talk about the stellate ganglion block in general, they talk about it working or not working, but really, if we have a good Horner syndrome, it's a successful block. So what we're looking at really is what percent success rate does it have for each symptom, right? So each symptom really has a different success rate. So anosmia seems to be responsive. About 90% of the time or even higher, whereas parosmia tends to be in the 60 to 70% range. And like I said, what I consider a success rate with parosmia is things are nasty now, or this particular food or drink is nasty or smell, and that part goes away. And even if it's not tasting or smelling normal, it's no longer disgusting, so it allows you to eat, and therefore I consider that a success. Things like brain fog, and chronic fatigue is also very high in the response rate, above 80%. And brain fog typically responds close to 100%. Britta is asking, what is the optimal time to do a stellate ganglion block? Um, Both her and her daughter had a good Horner's response, but no improvement. So there is no best time to repeat it. It just the stellate ganglion block did not succeed at unsticking your pedal. Assuming your symptoms are still the same, whether it's anosmia, parosmia, brain fog, or fatigue, or one of the other myriad of symptoms that long COVID causes. Um, so if nothing has changed, then the stellate ganglion block didn't succeed in unsticking your accelerator pedal. So I usually try at least one more time to see if I'm able to do it the second time. But if not, I have created this new protocol where it's more intensive approach to the stellate ganglion block. where we will essentially do it over a course of 3 to 5 days and continually um, do the do the stellate ganglion block on each side to hopefully unstick that pedal at that point. I posted more information in our long COVID treatment group. Gary's asking about the dizziness that happens with long COVID, and dizziness and vertigo are both linked to um, are both linked um, to long COVID. That's a known symptom. We know about it. This may be due to the blood flow issue inside the brain because when your sympathetic nervous system is running 24/7, blood is diverted to parts of your brain that are needed for fight or flight. And when you continue that chronically, it will result in dizziness and vertigo and other neurologic symptoms. Another possibility is there's some inflammation in the brain as well. Let me take a look at the question again. So anything neurological or psychological, I recommend starting with either the stellate ganglion block or the vagus nerve stimulation because those symptoms tend to respond the best to these two. Um, so I would probably start there, Gary. Holly's asking if intermittent fasting or diets affect recovery from long COVID. So that's also kind of a loaded question. Assuming you're able to eat any food that you want and you're not suffering from parosmia or anosmia or dysgeusia. So intermittent fasting, there's been some evidence that it helps improve parasympathetic nervous system tone. So there's potential there for help. There's no particular diet though that you can eat or drink or supplement even that will treat parosmia or anosmia for you. Um, it as long as you're getting the proper nutrition, it's fine. I do recommend supplementing vitamin A, D, and K um, uh, to to help with some of the healing aspects. But there's no particular diet um, that will make a huge difference. Jack is asking, how do you measure HRV? And HRV is heart rate variability. So this is different from your heart rate, and it's actually the distance or timing between each beat of your heart. So it would be in the milliseconds, so 1,000th of a second. And the really only way to measure it is by using a specialized watch with an app, or Fitbit has it, and Oura Ring has it, and there's a few other bands like Muse has it. There's many. I don't want to recommend a specific one. You have to find something that you can afford and that you're going to wear all the time. So HRV is not one of those things that you measure once and you put it away and you kind of pick it up in a week or two or a month. You really want to be doing it several times a day. So it's best not to think about it. So there's plenty of apps that work with various devices that are available on Amazon or Walmart or any of those. And basically pick whatever works for you and that you're gonna wear all the time. So you wanna get these patterns, on a daily basis and several times a day and preferably even while you sleep. Um, so that's basically how you do HRV. Verdant is asking about, intermittent and long fasts and having some success with it, but the results didn't last. Well, again, the goal here is to improve the parasympathetic nervous system, your vagus nervous system, where that's where the healing happens. So, if it's not lasting, it's because it hasn't done its job. There's hundreds of different ways to stimulate your vagus nerve and your parasympathetic. Some are easier than others, some are comfortable, some are not. So, it's basically up to you to choose how to stimulate the parasympathetic nervous system. I mean, things like box breathing or deep breathing can help improve your parasympathetic nervous system and the vagus nerve. But I find the easiest thing is just to stimulate it. I mean, we're trying to indirectly influence the parasympathetic tone, but when we have a method to use that's direct, just basically stimulate it. You know you're going to be stimulating in your parasympathetic, your vagus. There's no question about it. So Holly's asking about another approach of the stellate ganglion block? I'm not sure, Holly. Referring to second approach. So, I'm not quite sure what you're asking about a second approach to SGB. I mean, there's really only one correct way to do it. If we're talking about an ultrasound guided approach, there's a couple of different ways it could be done, using fluoroscopy or X-ray. Oh, I see, Holly. You're asking about doing it over 3 to 5 days. So, yes. So in this particular approach, it's meant for people who are non-responders. So you've had a stellate ganglion block, and it had a very good Horner's and, Horner syndrome, and you had it both on the right and you had it on the left, and, you had no relief at all, no recovery, no relief, nothing budged. So the idea of this non-responder protocol is to kinda blast it. Um, so you're not being stuck every day multiple times. I was planning to put in a small plastic catheter and, dose it, twice a day, once on the left and once on the right, and to do that over 3 days or to do that over 5 days, depending on, the person's availability. And hoping that the multiple attempts at pulling on that accelerator pedal, think of that crowbar, you pulling it and pulling it and pushing it and pushing it. And I'm hoping that over time, if we're doing it over consecutive days, that it will finally unstick. Um, there's no there's no definitive evidence that something like this would work, but there have been some studies suggesting that repetition of the stellate ganglion block does help. The problem is you don't want to stick needles into somebody's neck, for 3 days straight or for 5 days straight because it's gonna create a lot of trauma, a lot of inflammation, and it's gonna be uncomfortable. So I'm trying to do it in a way that, will not be uncomfortable. So that's essentially, this idea of this new protocol. I don't believe anybody else has tried it anywhere. I haven't seen anybody post or talk about this. Um I mean, I don't wanna say I invented it or anything. It's just I'll probably be the first one to ever try it. Um, so that's basically that. So Holly's asking about the cost. So this is obviously gonna be a little bit more involved than your typical stellate ganglion block. It's gonna involve a different type of needle and a catheter and obviously dosing it, multiple times, during the week. So, yes, the cost is gonna be different, it's gonna be higher. I don't know exactly yet where, the cost is gonna fall. We need to analyze, uh, everything, including our supplies and, uh, the time that's needed to perform this and staffing required, and also, obviously, the procedure room use or utilization. So we need to consider it. Julie's asking if this protocol is different from PRF. Yes, it's a completely different protocol. So, with PRF or pulsed radio frequency, the point is you're introducing, kind of different needles again, into where the stellate ganglion lives, and, putting in a radio frequency probe, and then delivering, um, a high frequency pulse multiple times over time, um, to that area, and ideally, what should happen is that the nerve conduction will stop, at least temporarily. It could be as little as a week, or it could be as long as 3 months. You're not gonna be having Horner syndrome for a week or 3 months, okay? I want you to understand that that's not how this PRF works. So, the idea is to do both sides at the same time. So, but you don't want to do, the local anesthetic on both sides because, again, the whole problem with the throat being an issue, the recurrent laryngeal nerve and the vocal cords. So this may be an issue if you're doing, basically a stellate ganglion on both sides, which you can't do at the same time. So you still would do the PRF on both sides, but you just wouldn't put the local anesthetic on both sides, the same way. I hope that helps. The PRF protocol is really meant for if you've done several different stellate ganglion blocks, you're getting great results, okay? You're getting recovery, but they just don't last. You have reversion of your symptoms keep coming back over and over again, no matter how many times you repeat the stellate ganglion block. So the reason for doing the PRF is different than doing this non-responder protocol. So the PRF is meant for people who get a great response. They get recovery, it just doesn't last. It reverts after a few hours or after a few days or after a week or 2. If you've had an stellate ganglion block and you've recovered for 6 months, you don't need to do a PRF, you just repeat the stellate ganglion block. I mean, 6 months is a pretty good, duration of recovery, and if you do the vagus nerve stimulation right after your stellate ganglion block, you do the deep breathing exercises, there's a very good chance you're not gonna revert, you're not gonna have to come back. If you get sick again, if you get an upper respiratory infection again, um, Alicia is asking, "Have I tried the PRF yet?" Yes, I have. I do these all the time. Um, and again, the point of doing a pulse radio frequency is to help somebody who just doesn't get the duration from the regular, stellate ganglion blocks. I think over time, with the parasympathetic and the vagus nervous system doing its work, it will heal, and you won't need to get these repeated over and over again. Shane is asking if I have specific deep breathing exercises that I recommend. So, the simplest way to that I recommend is just doing the box breathing, which is and you don't have to do exactly these amounts of times, do what you can do. But the idea why is it called box breathing is you basically take a breath in over, let's say, 4 seconds, you hold it for 4 seconds, you exhale over 4 seconds, and then you hold again for 4 seconds, and you repeat this, and it kinda looks like a box, if you were to graph it out. So that's the easiest way to do it and, the simplest of the breathing exercises, and it will help your, parasympathetic tone be a little higher. So will yoga, so will enjoying a good book, so would taking a nice walk. I mean, anything that relaxes you will help, improve your parasympathetic nervous system. It may be different for everybody, what relaxes you, but you don't wanna be, someplace where you're aggravated or, uh, your sympathetic nervous system is thrown into fight or flight. So, getting into an argument, getting into a fight, uh that's not ideal for healing. So, we want to downplay the sympathetic nervous system and the high tone that it's already in, and this is why a lot of these symptoms happen, is because, with the sympathetic nervous system being so high, your body is always on edge. You're feeling fear, you're feeling anxiety, you're feeling depression. Some people actually even get PTSD from this. don't sleep well. You don't sleep well because how can you go to sleep? And yes, you may be unconscious, but your body's not gonna let you get to deep sleep. It's worried something is gonna happen. I mean, from your body standpoint, from your brain standpoint, it thinks you're gonna be attacked or hurt in some way, and, how can your brain get to deep sleep in that situation? If you spend a couple of minutes of your night in deep sleep, that's great, but you're really supposed to be spending about 25% of your entire sleep cycle in deep sleep. And yes, that does decrease as you get older, but the idea is you still have to spend a good amount of time in deep sleep because that's where healing happens. It doesn't happen in REM sleep, by the way. REM sleep is when your brain processes everything you've been through the day or through the week. This is how it deals with conflict, and it may manifest itself as a dream or it may manifest itself as a nightmare. But the whole point of that is so that it processes everything you've been through and incorporates it either into your permanent memory or discards it completely. So it basically reconciles everything that you've dealt with for the entire day and sometimes even longer, sometimes the week. Sometimes you wake up in a cold sweat from this because the sympathetic is what's really active during REM sleep. So we can't avoid REM sleep. You need it. You absolutely need REM sleep. Um, Otherwise, you're not gonna do well. But it's not really what our bodies need from a healing standpoint. I know I kind of went off on a little tangent, but I hope that that answers the question about deep breathing exercises. So yes, Shane is asking about deep sleep is different from REM. Yes, it's completely different. Um, so if you do an EEG actually of your brain, REM sleep is rapid eye movement. From an EEG standpoint, it looks like you're awake. You have essentially alpha wave activity, and your body actually has to paralyze itself in order for you not to act out your dream or your nightmare. Um, Otherwise, people could get hurt. So during REM sleep, your body basically shuts off your motor ability. You can't move anything except for your eyes. Your eyes are the only thing moving. You can't move your body, you can't move your head, you can't move your arms, you can't move your legs. You basically can't move anything, and that's probably a good thing during REM sleep. So, kind of an interesting side note is sleepwalking or sleep driving or sleep eating. That doesn't happen during REM sleep. That happens during stage 3 deep sleep. That's a very, very different. That's why it's able to be done under deep sleep, but not during REM sleep. Britta is asking about horrible headaches. So again, headaches are unfortunately a part of long COVID, and it could be there's very very many different kinds of headaches that can happen with it, including dizziness, including vertigo, including tinnitus. Other symptoms that we know about are problems with your voice or problems swallowing. This also comes from basically vagus nerve dysfunction. So long COVID kind of hits you from two angles. One is the high sympathetic tone, which happens most often in other kinds of dysautonomias. But it also damages the vagus nerve. It thickens. We know this. It's seen on MRIs. It's seen on ultrasound. The vagus nerve is thickened, and when it's thickened, it's not conducting well, and therefore the overall activity of the vagus nerve is low. So it kind of gets you from both ends. It both pulls up and pulls down at the same time. So it's that much more dangerous than your average old dysautonomia that we see. Um, What to do about headaches? So these headaches typically don't respond to the usual treatments, how we treat headaches, with nonsteroidals and pain medications, and maybe even some people get Botox for chronic migraines, for instance. They don't seem to respond as much from long COVID as they do without long COVID. So you would treat this the same way you would treat the source, which is the dysautonomia. You would either try treating it with a stellate ganglion block, or you treat it with the vagus nerve stimulation. So Shane is asking about the thickened vagus nerve. Um, well, we don't know. The answer is we don't know, because it's just recently discovered, and it's only been 3 years now since long COVID really started, or maybe 2.5, 2 and 3/4 years since long COVID started. The problem is we don't know if it's gonna return back to normal. We don't know if it's gonna de-thicken, as you put it. Um, we don't know if it's gonna be significant years later. All we can do right now is try to stimulate and increase its activity, which you can do both ways. Stellate ganglion block doesn't just decrease basically the sympathetic nervous system at the stellate ganglion. It also improves the vagus and the parasympathetic. Remember what I said? It's linked. It's on a seesaw. So when you affect one, you affect the other. Whether you want to think about it as a tug of war, one pulling, one pushing, or both pulling, or a seesaw where one is up and one is down all the time. I mean, you can't have both up or both down. So I guess the seesaw kind of makes more sense than a tug of war type scenario. But um, we don't know if the thickened vagus nerve is going to be significant over time. I mean, it's been noted. We know that the vagus nerve doesn't function well during long COVID, but that doesn't mean that it won't function well over time, even if it's not de-thickened, as you put it. Julie's asking, how do we decide which protocol, yeah, I guess, which protocol is the best? Well, I mean, they're meant for different purposes. The protocols we're talking about is the non-responder stellate ganglion block protocol and the PRF protocol. And again, this goes back to what we're treating. So the PRF is really meant for somebody who has really good results, but they just don't last. No matter how many stellate ganglion blocks you throw at the person, and by the way, I will never do more than 2 per side, before moving on to PRF, because I think it's kind of a losing battle, and, you know, the law of diminishing returns. I think it's just, expensive to keep repeating the same thing and expecting a different result after 2 times. So, that's when I would do the PRF, and, the non-responder protocol is really meant for somebody who doesn't respond. I mean, they've had the stellate ganglion block once or twice, and they really have not gotten any recovery at all. So they're really deep in the trenches with the stuck accelerator pedal, and I think just um, throwing SGBs at them one at a time, every couple of months, every couple of weeks, doesn't really make sense. And doing a PRF for them won't really help, since the whole point there is it's the PRF doesn't unstick the pedal as strongly as a stellate ganglion block, but it lasts way longer. So that's why I use it for people who get a great result but don't have the duration for it. Whereas the non-responders, what they need is not the duration, they need multiple attempts at unsticking that pedal. Kinda keep hitting it, with that hammer, or, pulling it with the crowbar until it budges, until it breaks. I mean, you gotta get that thing loose, and until that happens, nothing else will resolve. None of the other symptoms will get better. Can you get Can it look better? Of course. It could look better from a compensatory mechanism. Your body tries very hard to kind of get some semblance of normal, but it's not. If you look under the surface, the HRV still is going to be low, the heart rate variability is still going to be low, the vagus nerve is still not going to be functioning well because you haven't healed. Your body compensated, but you haven't healed. Shayna is asking about if I've seen the thickened nerve and ultrasound. Yeah, I see it all the time. In fact, I was one of the first ones to report it. I was looking, when I'm performing my stellate ganglion block, I examined the thyroid, which I was told not to do by ENT doctors because they don't like it when I find nodules. Because I guess they don't like to go back and sample them or biopsy them, and I guess most nodules are not significant in the thyroid. But I also look at the vagus nerve. I know where it lives. I know what it looks like. I know what it looks like normally. And approximately 80% of the time, especially for long COVID patients, I see it thickened. I see it bigger and thicker than somebody getting a stellate ganglion block, for instance, for PTSD. Their vagus nerves are normal. Um, and this correlates with a study that was done or a survey that was done that looked at vagus nerve activity, and they determined it was dysfunctional. And there was another study looking at MRIs. And again, the vagus nerve has been thickened between 60 and 80% of the time in people suffering from long COVID. Holly's asking if we never get unstuck or remain this way our entire lives. Um, I prefer to think that, you know, everybody can get unstuck. It's just a matter of persistence. Um, I don't think it's survivable to be stuck in a sympathetic storm or sympathetic fight or flight response 24/7. Your body will compensate because you cannot get epinephrine basically spilling out of your adrenal glands and cortisol being spilled out 24/7. It's just not doable. Your body can't handle that, so it has to make some adjustments, some compensations to basically mediate those responses. Um, so no, I don't think this is a lifetime basically stuck pedal. I do think eventually it will unstick, but I think if we help it, there's a good chance it will unstick sooner. Um, Verdant is asking about have I found people with prior hyperthyroidism to be more prone to long COVID and the thickened vagus nerve? No. What I found is that there's a lot more autoimmune problems with long COVID. So thyroiditis seems to be more common, such as basically inflammation of the thyroid. Um, there's been some association with rheumatoid arthritis, some association with Sjogren's, um, which is the whole dry mouth and the issues with the oral, um, and the Raynaud's and celiac disease. These seem to be kind of cropping up, including some dermatological problems and lesions that we see cropping up, including hives um, that happen. So, to answer your question, no, hypothyroidism does not put you at risk for long COVID or anything. But what does is anything that potentially can damage your autonomic nervous system. And what is that? So, Lyme disease. Lyme disease can damage, whether you had in the past or you have it now, or you have a chronic case. That can damage your autonomic nervous system. The most common is diabetes mellitus, type 1 or 2. That really does a number on your autonomic nervous system. And, it doesn't just cause peripheral neuropathies and problems with the glucose. It actually does damage to your autonomic nervous system. Um, EBV, Epstein-Barr virus, mononucleosis. It is part of the herpes family. And while many kids don't really have any symptoms when they get it, the kissing disease mononucleosis, um, that could potentially, because the EBV virus hangs around, and even if it's dormant, guess where it lives? It lives in nerves. It loves nerves. Um, all herpes viruses seem to like nerves, um, and it can damage your autonomic nervous system as well. There's many others like lupus and rheumatoid arthritis. All those can potentially damage your autonomic nervous system as well. But those put you at risk for developing a long COVID. So Amy's asking if an SGB or stellate ganglion block have any impact on peripheral neuropathy. Well, it's interesting that you should ask that. So I've had several patients where I didn't really want to treat them for the neuropathy. But if they've had a new neuropathy in their arms, for instance, or in their hands, either side, for some reason, it has responded to a stellate ganglion block. So this kind of confirms or reinforces that having the dysautonomia that long COVID causes can inflame nerves. Chronic inflammation is not well regulated when your sympathetic is high and your parasympathetic is low. And this is very different from an injury type scenario where your nerve got damaged, let's say by diabetes, by high glucose. Um, so yes, the neuropathy can pretty much go away within a minute or two of getting a stellate ganglion block. Now, if it's in your legs, I don't know. I haven't really had any patients with lower extremity neuropathies from long COVID. But look, if you have a peripheral neuropathy pre-existing, no, the stellate ganglion block is probably not going to make a huge difference in that. If it's from CRPS, yes, of course, that's going to treat the condition in your arm. But if this is a new peripheral neuropathy in your fingers, in your arms, in your forearms, in your shoulder, and you have the pins and needles, you have the burning pain, you have the numbness, you have the tingling, yeah, that seems to respond. So I'm thinking that this is a chronic inflammation issue in the nerves of the arms. Um, and it is caused by the long COVID, and because secondary to dysautonomia. So, Megan is asking about cortisol, and if the levels are normal, does that mean that you're not in overdrive? Unfortunately, no, because like I said, your body will make adjustments. It has to. You can't have your adrenal glands continually spill epinephrine and cortisol into your blood. It'll kill you. You can't be in fight or flight 24/7, even though you are, but your body will make certain adjustments so that you can survive, basically. So this can happen for two reasons. One is that the adrenals basically burn out. It can produce. It is designed to produce cortisol. For certain amounts of time, and after a while, it says, "I got no more." I mean, I can't make any more. I gotta make some more before I can release it. And the other reason, like I said, it's a compensation by your body, and it's a good thing because you can't constantly be in a fight or flight situation, despite what your sympathetic wants it to be. Hope is asking if the block would help with reactivated EBV. Not really. I mean, the reason that it becomes reactivated is because the immune system becomes compromised. Again, with this dysautonomia, it can cause issues with autoimmune conditions. It can also cause problems with your immune system, where the immune system is not working as well as it should be. As soon as the immune system relaxes a little bit, EBV says, "Oh, look, time to come out and play," and it does. Um, so no, with a stellate ganglion block in itself won't help with reactivated EBV, but if you do the block and it treats the sympathetic nervous system, the fight or flight response, and that basically goes down, the vagus and the parasympathetic goes up, there's a good chance your immune system will come back to normal, and that will should hopefully take care of the EBV on its own. And this will be our last question from Holly. Um, this is about Lyme disease. Let's see here. So Lyme disease is a little tricky. So if you know you've had Lyme disease, if you had the bullseye rash and you've gotten treated, okay, um, to completion, you don't have Lyme disease anymore. But if you didn't get treated, if you had the bullseye rash and you just left it alone, it could become chronic, where it's sort of pseudoactive and it may not cause the same symptoms, but it's still in your body and it's still doing its thing. The tests for Lyme disease are a little bit iffy um, for chronic Lyme disease. Sometimes you have enough of I guess, pathogens so that the test can be positive, but other times it shows up negative despite the fact that you still have it. So the big question here is did you get treated or not? Was it a confirmed Lyme? And did you properly treat it? Did you take the proper antibiotics and treatment to treat it? So um, having Lyme, of course, puts you at risk for getting long COVID. There's no question about that. But whether or not you still have Lyme really depends on if it was treated before or not. Um, thank you very much. It was a great hour, and we'll be doing this once a month. I believe our next one will be in the first week of March. I'm sorry, the very first week of February, and on Saturday as well, around 12 to 1, the same. And I will also be doing either weekly or bi-weekly segments on different areas of long COVID. Some of the things that people have asked me, or things that are on my mind that I'm still um, kind of working on or trying to describe. My whole point with this series will be it will be short. It'll be between 10 and 20 minutes at a time, and the whole point of it will be to take complicated subjects and matter and kind of break it down to make it easy to understand. Um, okay, thank you so much, and we'll see you next time.